Good morning. It's October 28, 2022. It's a Friday. Thank God it's Friday for some. And for some, when is Friday going to be over so you can be on your way to your vacation for the weekend? Anyway, welcome to the program and its agenda. And I'm your host, Cito Beltran, thanking you for being subscribers of Cignal TV, viewers of One News, especially on channels 8 and 250. And of course, thank you to those of you who watch us on Facebook and YouTube. Just put in One News Agenda. Okay. And good morning to our viewers in Tagaytay, Mr. Mike Romulo, and then also to Doc John Danico in Bacolod. Thank you for watching us. And of course, to the other friends, doctors who watch us, you're going to find today's program interesting because we are going to interview a physician who has recently been chosen to be a Ramon Magsaysay Awardee. Very interesting topic, a bit disturbing, but interesting nonetheless. Okay, let's first go to our daily starter. And here we go from motivational speaker and author Alexander Den Heyer. Okay, Den Heyer. When a flower doesn't bloom, you fix the environment in which it grows, not the flower. Okay, that is a very interesting, very timely daily starter because many people try to fix the person, not the environment, and it's slightly related to our topic for today. Now, let's go to the front page of the Philippine Star. Financial probe begins for lapid slave brains. The Anti-Money Laundering Council is helping the Philippine National Police follow the money trail. They are going to look into the 550,000 peso payment made via bank transfer to the account of the now deceased second middleman in the Percy Lapid murder. And at the top of the front page, heads up for all of you planning to go out starting today, tomorrow, and over the weekend to the provinces for All Saints and All Souls Day. Storm Paeng to make landfall in Luzon on Sunday. Okay, tama po yan for Halloween, for All Saints Day. Storm Paeng is expected to make landfall on Sunday. It will be causing a lot of rain, and the projection is North Luzon westward, or possibly eastern border of southern Luzon. So Bicol, Cagayan, etc. Be careful, but also projected to cause a lot of heavy rainfalls in Metro Manila as well. So ingat po tayo. Meantime, on the upper left corner of the Philippine Star, we have a photo of Vice President Sara Duterte and President Bongbong Marcos having an animated conversation in Davao City, where they were guests in the groundbreaking of the 23 billion Samal Island Davao City Bridge Project. And the bridge project will connect Davao City and Samal Island, resulting into a travel time estimated to be less than 5 minutes. The bridge project has also been financed through a loan from the government, from the Republic of China. Meanwhile, COMELEC has announced voter registration to resume December 9, and it will go on up to January 31 2023. They are not going to make a long voter registration because it will run in tandem in the launching of the Register Anywhere project of the COMELEC, which will begin with 5 selected malls in the National Capital Region. So in other words, there will be a pilot test of a program where you can register in malls. If it works, then it will take the place of these voter registrations that are done in the various offices of the COMELEC. Okay. Meanwhile, the Department of Health projects or believes that we will go from 2,500 daily COVID cases. We could jump up to 18,000 daily COVID cases with the new proposal of masks being voluntary indoors, face mask wearing being voluntary indoors. So yan po, pinangangambahan. That is the fear, the concern aired by the Department of Health, because there are several sub-variants that are highly contagious, highly transmissible, and with people no longer wearing masks or making it optional, we could really have a serious problem there. The big photo in the middle of the Philippine Star, don't be worried, it's just a test. It is just a training simulation. That helicopter over Manila Bay and the Coast Guard spraying a tanker, that's all part of the training program of the Philippine Coast Guard that did their marine pollution exercises yesterday. The idea is for the Coast Guard to have readiness capabilities concerning oil spills and disaster at sea. Meanwhile, speaking of disasters, Northern Luzon quake, the one that happened in Abra, the 2 quakes that have happened in sequence, has had 667 aftershocks. So yan po, no, medyo talagang nagbabago ang lupa dyan sa Luzon, Northern Luzon. Please be careful, especially when visiting all of the historical churches and really old structures kasi delikado pa rin po. Meanwhile, the polymer-based, yung bagong pera, the polymer-based 1,000 peso bills are now available in 2,425 ATMs, and the Central Bank or the Bangko Sentral ng Pilipinas is doing a circulation test and is calling upon all the ATM operators, banks, etc., to recalibrate their ATM machines so that the machines can dispense the new 1,000 peso bill. Now, what is the big deal? Apparently, with the new 1,000 peso bill, because of its material and its design, the wear and tear is going to be 2.5 times better. So we are going to be saving between 1.26 billion to 2.4 billion from the longer lifespan of the polymer money instead of the paper money. Okay. And further down, sana good news po para sa mga kamag-anak na may mga OFW. The Bureau of Customs orders delivery of abandoned unpaid balikbayan boxes. Apparently, 2 companies that have abandoned or unpaid balikbayan boxes shipped by Island Kabayan Express Cargo and Win Balikbayan Cargo will be delivered by the BOC directly or through courier to the addressees or intended recipients. Maghanda lang daw po kayo ng ID. It seems that something went wrong in the system of those two shippers, or I don't know what, pero BOC na raw ang magsa-Santa Claus para sa inyo para naman may matanggap kayong tsokolating luma na. Okay, sorry. Just trying to make things amusing. Pero sa tagal niyan, sa biyahe, palagay ko, hindi na tsokolate yan, sabaw na yan. And in the meantime, let this be a warning to all of you who are planning to enjoy your vacation this All Saints and All Souls Day. Here's a photograph at the bottom of the Philippine Star. Local and foreign travelers line up at the counters for domestic flights at NAIA Terminal 3 yesterday. A high volume of passengers is expected in airports, seaports, and bus terminals for the long undas break. So, habaan ng pasensya, i-charge ang cellphone at ang laptop para meron kayong pampalipas inis sa airport, seaport, at sa bus terminals. Last but not the least, Manila City Mayor Hanilet Lacuna, or Hanilet ba? Hindi, Hani Lacuna lang. Nako, mali. Sorry po. Hani Lacuna Pangan wants all visitors to Manila cemeteries to still wear face mask. Tama lang po yan. Dapat lang because tuloy-tuloy pa rin po ang pagkalat ng COVID, and some people say, okay lang, para lang sipon. Tell that to my friends who spent several thousands of pesos at the hospital and for medicine. Hindi po mura ang gamot for COVID. Ha? Hindi ko nga ma-pronounce sa sobrang hirap i-pronounce nung gamot. Lalo na pag magbabayad ka na, lalo kang mabubulol. Okay, so that's all we have for the news on the front page of the Philippine Star. As I mentioned earlier in the program, or at the start of the program, our guest for today is a recipient of the Ramon Magsaysay Award for 2023 and is a physician. Now, you know, most people will say, oh, another awardee like this, like that, maraming dami. No, this is special for me because as I was reading her story, about a month ago, ganun katagal ko na siyang hinahunting. Ang hirap talaga, hindi ma-reach. Sobrang sikat, hindi ma-reach. Okay? But as I was researching, reading materials about her, there were very disturbing revelations about stuff that goes on in the Philippines we don't seem to realize. And, you know, we Filipinos tend to think, oh, we Filipinos are loving, are protective of our children. We care for our children. We go abroad to make them study in best colleges, etc. But I was shocked to find out that 3 out of 5 children actually suffer abuse. 1 out of 5 are a victim of sexual violence. And, you know, if you're better off in the economic ladder, you tend to be unaware of these things. And if it were not for people like our guest today, we would not be confronted with the problem. And she has dedicated her life to it. And it is a very interesting journey. Let's introduce our guest through this video.
Dr. Bernadette Madrid was recently named as one of the 2022 Ramon Magsaysay Awardees. A children's rights and protection crusader, Madrid has devoted her career to addressing violence against the youth. In 2021, she was named Outstanding Pediatrician by the Philippine Pediatric Society. Prior to that, Madrid earned the title of Most Influential Filipina in 2019, an award from the Filipina Women's Network.
Dr. Bernadette, good morning and congratulations.
Thank you, Cito. Good morning sa inyo at sa lahat na nakikinig sa'yo.
How has your life been since they announced that you are a winner of the Ramon Magsaysay Award? Kasi like I mentioned, hindi ka yayaman kasi hindi ka na ma-reach.
Super busy. Kung busy ako noon, mas lalo pa ngayon. Kaya nahirapan tayo mag-schedule. Pero siguro hindi naman forever yan.
Okay. Now, how did the news come to you? Because, not everybody gets chosen for the Ramon Magsaysay Award. There are awards, and then there is the Ramon Magsaysay Award. That is extremely prestigious and a thing of great honor. How did you find out that you were actually a winner?
Surprised by it kasi unlike other awards, you don't know that you were nominated. Secret pala yung nomination. And then you also don't know that they were gathering information about you. So, alam mo na lang kung officially ka sinabihan na. So, I was in a Zoom meeting about something else, and then the president, si Susan Afan, came on and told me that I won the award. So, I was so surprised. Really, really shocked.
Okay,
but
now
nicely, of course.
Okay, pleasantly surprised,
yes,
and shocked. Okay, now the question is, how did you how did you process this? Because you have been low key, below the radar, operating. In fact, you are so below the radar. It was only after you won that I heard about you. And when I read about you and the work you do and the facts that you put out there, now I have to confess, I had some sleepless nights just thinking, I couldn't digest the data that was presented regarding child abuse in the Philippines. How did you process, winning an award versus, this is my life? Does it complement each other, or parang hello, hindi award ang kailangan? Because some people, it's like, yeah, thanks for the award, but could you just focus on this problem instead of that?
I appreciated the award, and of course it's not all of these media interviews. I mean, I've been in some, but we don't really. I don't really seek it out. Because for our patients, they really would like confidentiality and privacy. So we don't want to, make them insecure about that. So what we'd like more the focus to be is to the situation. So if other people can bring it out, we provide them the information, so much the better. We don't even allow the press to take pictures of our unit because considering the situation of our patients.
Yes.
Pero the award, I know, will bring also the attention that we want, that we need to do something, that it is urgent, the problem is really bad. Our statistics really show how prevalent, child abuse is, and now we have on top of that the online child sexual abuse and exploitation together with the offline, and it makes it worse. And if we don't do something about it, it's our whole population and our future, aside from the suffering today.
Okay. How did you get into this, Dr. Bernadette? Because you're a pediatrician and you graduated from the best university in the world, UP. Sorry, there is UP and there are others. Okay,
I'm with you.
Biro lang po. But you could have chosen a path. Some of your colleagues, I'm sure, or kabatch, must have gone abroad. Put up clinics abroad, further studies, and lived comfortable lives in the limelight as well, with lots of money. But you end up being a fighter. That's how they labeled you. The warrior for the children's warrior, children's defender. How did that all happen?
I'm a pediatrician. I think first of all, pediatrician.
Mhm.
And for me, to be a pediatrician means that you will take care of the whole child. No, hindi lang yung kung ano yung presenting na sakit.
Mhm.
So it was very natural. No, when I found out na naku, ang dami palang abused children. And then there were really no services for them. So kaya ako napunta dun. Because
When you say ang dami palang abused children, could you quantify this, please, or just give an example to our viewers? Because I think most of us find it so ugly, so dark, and it's hard to face it. Kumbaga, like me, I will turn violent when I'm confronted with these things. It just makes me angry, and I want to lash out at people who do these things. Others will just walk away and close their ears and close their eyes because they can't deal with it. I mean, when you said, nako, ang dami palang child abuse cases, how bad is the situation? I already said 3 out of 5.
Yeah, that's the 3 out of 5. And if you put that into numbers, easily, we have 40 million children, approximately.
Mhm.
3 out of 5 easily might be 20 million, So, I mean, those millions. But of course, hindi naman lahat nagre-report. The same study that I'm quoting, yung national baseline study natin sa Pilipinas, shows that only at the most 10% to 12% of that will disclose, hindi pa nga report. Disclose, that means they tell a friend, they tell their mother, pero only 1%, even less than 1% will report. So, pero even that less than 1%, marami pa rin yan. We're talking like may around 10,000 a year, so marami pa rin yan.
Okay, well, let's be clear about our definitions here. When you say child abuse, because we in media, sad to say, we generally only tell about brutal, violent, ghastly cases of abuse. But as a pediatrician, or in your field, in your experience, what constitutes child abuse? Ano ba yung mga klase? Paano ginagawa?
There are different types, di ba? May physical, sexual, emotional, at saka neglect. Sa 3 out of 5 dyan, we didn't even count neglect dyan. No? Sa physical abuse, dyan parate ang diskusyon kung abuse yan or hindi. No? Because anytime you lay a hand on a child with force, you have crossed the line. Kahit walang mark yan. When we say, if you probably yung nasa media ay yung patay na yung bata o nasa ICU na, yan siguro yung pwede, no? Pwede, but not most of the time will catch the eye of the media. So so we don't even know ano yung percentage yung namatay o na ICU because we don't have the statistics. Hindi alam, no? People don't believe that any parent.
Why is that, Dr. Bernadette? Why is it that we don't have that data or that statistics? Because that would be telling. That would, for instance, tell Congress, hello, 3 out of 5 children are being abused in different forms. You need to assign more budget for child abuse facilities.
Kasi first of all, yung mga doktor, ayaw din nila gawin yung diagnosis, to make the diagnosis that the cause of the injuries is physical abuse. No, they themselves find it hard. In fact, in my lectures, I teach in the College of Medicine. I always say that it takes courage for a physician to make that diagnosis that it is physical abuse. They would think of more other other diagnosis, baka ganito yan, some other genetic condition, for example, like osteogenesis imperfecta, the bones are brittle, kaya maraming fractures yan. They don't want to face the fact that it's abuse, and second, they don't want to be involved with the court system to testify in court. O baka balikan sila ng parents and then will be sued, those kinds of things.
Is there a law that now requires physicians to make such a report? Because in the United States, if a attending physician, especially in an emergency room, finds or comes across findings of physical abuse, domestic abuse, etc., or even serious neglect, they are required by law to report. Dito ba sa Pilipinas, meron na, wala pa?
We have a mandatory reporting, part of the law against child abuse. May mandatory reporting wherein yung mandatory reporters are physicians, nurses, and heads of hospitals and clinics. Pero if you don't report, the fine, you only have to pay a fine, and the fine is like 2,000 pesos. You know, sa United States, in the beginning, meron din silang mandatory law. Nung mababa yung fine, yung baliwala naman yun sa doktor, no? Mababa din yung reports nila. Pero nung tinaasan yung fine at may jail time pa, ayun, dumami yung reports nila, no?
And actually, what about the Philippine
law,
medical? What about
the law protects the doctors, ha? If you report, you are protected from countersuits, actually, no? Pero still, they don't want to be involved with the court system.
What about the PMA, the Philippine Medical Association? Don't they have a system of sanctions, or they have the power to strip a physician of license, don't they?
Yes, if somebody files a complaint. But no one does. Who will file the complaint na hindi nag-report yung isang doktor? Wala.
Until the child dies.
Even if the child dies, kasi the parent will not file a complaint because they won't. If they're the ones who caused the injury, they don't want that to come out because sila ang makulong. So no one.
So that's one problem that needs to be addressed. The monitoring and the reporting system of such abuses. But before we even get to such an extreme, what discoveries have you made, and what solutions have you implemented? Because from what I understand, you are principally responsible for setting up a child protection unit at the PGH, or you are part of that. What discoveries and what solutions have you made regarding this issue of child abuse?
So in the beginning, we just started with one clinic at PGH. That was 25 years ago. And today is our silver anniversary. No, so in that clinic, we have doctors, social workers, psychiatrists, no, working together. And then we found out na it cannot be na isang clinic lang yan sa PGH. So that's when the foundation, the Child Protection Network Foundation, was started, and to help establish women and children protection units across the country. And so right now, there are 123 in 61 provinces. So may 20 provinces pa na wala. No, but these are interventions. That means na abuso na yung bata, no? But the goal there is, of course, not to stop that abuse, na hindi na mag-continue, and to treat yung mga either physical, mental injuries, and kung pupunta sa court, tulungan din yung bata. And it's long-term, no? Hindi yan mabilis. That recovery and therapy takes quite a long time. And keeping the child safe is a challenge, no? Depend kung dysfunctional yung family niya. Now, we're also starting with prevention. Kasi gusto natin, hindi talaga siya maabuso to start with. So we're also involved in promoting evidence-based parenting programs. We say evidence-based kasi ang dami namang parenting programs, pero hindi lahat yan effective, no? So there are certain components and way that it is done that has been shown to be effective. And we want na yun ang gagamitin na parenting program, yung may ebidensya that it works. And there are other things. We're working also, say, with the Department of Education, and we've done the research na yung sexual abuse, for example, meron kang ma-include sa curriculum on teaching children how to resist, for example, peer pressure, how to regulate their emotions, para na they make better decisions and they will not be so impulsive. We find na including that in the grade 7 and grade 8 curriculum sa values at saka sa health na subjects can prevent sexual abuse as well as sexual victimization at saka offending behavior. Kasi when you talk about the general population, may biktima, may offender. And you want to prevent both, being a victim or being an offender. So right now, we have already discovered, not only us, globally, no, na mayroong mga programa that can prevent abuse from happening. May evidence that it can prevent. So we should adapt those programs. Bawat sector may role, no? So ngayon, education lang yung sinabi ko. Kasi I was just in an RTD yesterday, but each sector may role.
Okay, let's go for a quick break. When we come back, I'd like to ask you to, thresh out all of those programs, those systems, because may mga ibang barangay, mga syudad, munisipyo that might benefit because half of the time it's really ignorance. Some people think it's discipline, not realizing it's abuse. Some people will say, but I have to earn a living. And then, I know of so many cases where yung nanay kinandado yung bahay para lang mamalengke, pagbalik nasunog na yung bahay, etc. So we'll go for a quick break, Dr. Bernadette Madrid, and when we come back, let's talk more about your life's work and where you want to bring it and what other people can do to make the Philippines truly child-friendly and child-safe. We'll be right back here on Agenda. Welcome back to the program Agenda. I'm your host, Cito Beltran, and with us is the 2023 Ramon Magsaysay Awardee, Dr. Bernadette Madrid, who is being recognized for her life's work on protecting children. And allow me to read this. Dr. Madrid leads the Child Protection Network Foundation in finding resources for the establishment of women and children protection units, WCPUs, and training specialists around the country. CPN's goal is to have at least one child protection unit or women and children protection unit in every province in the Philippines. There are 115 WCPUs in 59 provinces and 10 independent cities. And Dr. Madrid's network is also looking at collaborating with such agencies as the DepEd for the inclusion of programs on child abuse prevention and mental health in school curriculum. You know, come to think about it, Dr. Madrid, perhaps they should even go further as to put in training sessions during Parent-Teachers Association meeting. I remember being invited to one such PTA in Mandaluyong, and where I gave a half-day lecture on parenting. And hindi naman sa magaling akong lecturer, pero because naging tatay naman ako, I was able to impart to them that it is not about, you know, being rich or poor. It is about being a parent and loving your child. But anyway, going back to our conversation, Dr. Madrid, your dream, your vision is for every town, city, or whatever, to have a women and child protection unit. Kasi parang meron ngayong women and child protection desk ang PNP.
Police. Yes.
Ang police. But how different? Because the police simply take reports of cases, right?
Mm-mm. Yung police kasi, first of all, hindi lahat gusto may kaso. Like, you know, some of those cases that you described na yung nanay na nilak yung anak doon sa loob kasi na may trabaho siya and then nagsasunog yung gano'n. Sure, that is abuse, no? Pero sa atin namang kultura, hindi mo naman gustong ipakulong ngayon yung nanay na yan. Depende, no? So, of course, there's some who say na kailangan siya ikulong. But there are other milder cases like, you know na this is a parent na hindi niya talaga makontrol yung anger niya at saka, you know, whip the child. Ganon. They need help, intervention, definitely. But not, majority of this will not go to the police. No. And the intention lang ng police is to file the case. Hindi naman yan gawin na ang intervention na mag-parenting si police and seeing to it that the child is safe in the home, you know, o kung may injuries, i-treat mga yan. Hindi yan role ng police.
Yes.
So what we have done is that we have included the police also in the WCPU. So mayroon kaming memorandum of agreement with the Philippine National Police na bawat WCPU may partner na police. No, and in some of these WCPUs like the one in PGH for example, meron talaga kaming permanently assigned na police. Kasama, part siya ng team. No? So the police are really also essential in the response. Pero but we are more about a differential response. Depende sa kaso. Hindi naman yan lahat ikakasuhan.
What is the cost factor per unit? Because at the end of the day, you know, kung walang pera, hindi gagalaw yung unit mo. And it's hard to run these things on a voluntary basis. Or it could be, you know, maybe yung mga internship program ng nurses, internship program ng mga doktor, they can be put into that. Is there any attempts to like tap these resources? And how much money is required per unit? Yeah.
Ang pinaka-minimum, because we have different levels, no, depending on resources. So yung level 1, you have a doctor and a social worker. Sila lang. And then of course, the police comes in. Ang sweldo naman niya comes from the police, no? Hindi naman yung ospital ang nagsusweldo sa police. So you need the salary of the doctor and the salary of the nurse. Gusto rin naming may nurse, of course. Ang salary ng social worker. May plantilla naman yan sa ospital. Kaya lang, there are hospitals na they don't have enough manpower. Kaya yung doktor ay hindi siya full-time sa unit. Tinatawag lang siya pag may pasyente. And then the social worker, hindi rin full-time. Hindi ideal yan. We want them to be really full-time. So that is really your pinaka-basic na investment, yung sweldo ni doktor. Yung mga position, MS3 or even MO4, depende sa ospital. And yung sweldo ng nurse 1, no? And yung budget nila, yung operating budget, well, again, depende din sa anong ma-afford ng ospital. There are hospitals that give free medicines. Meron na kailangan bilhin yung gamot. No? Pero ang maintenance niyan, hindi, yung basic lang, is just a room, an examining table, just the privacy to interview, these patients. So, hindi naman siya mahal. No? Pero, even if I say that, just getting those personnel, that minimum doctor and social worker, malaking challenge na yan. Very big challenge na full-time sila dyan.
How difficult is it to track the cases? Because I would imagine hindi naman basta-basta unless may mangyari talagang masama o may nakakita, it doesn't come to your clinics. The child doesn't come to your clinics, etc. Paano niyo nalalaman itong mga cases na ito ng child abuse?
They have to come, no? So yung pasyente or the clients ng mga units na to, hindi sila yung actively you go out and look for them. Hindi mo sila mahahanap. Ang nakita namin is that pag nalaman na ng community ano yung mga serbisyo nyo and it's free, no? At saka paano nyo tinitreat yung mga kaso na ito na maganda yung pag-treat sa kanila, maganda yung outcomes. They come. No? So that's why sa PGH, for example, yung new cases namin is 80 to 100 per month. New.
What are these cases about?
Majority, at least 70% are sexual abuse cases. Now, bakit sexual abuse? Kasi sa ating kultura, ang physical abuse accepted yun. They just say, disiplina lang yan. No? So, hindi sila makikialam. Unless na halos mamamatay. Na even then, kahit mamamatay na, hindi pa rin nakikialam most of the time. Kasi it's like as if parents own their children. Pero yung sexual abuse, mas malaki yung motivation na pag nalaman, of course, kasi that if the child will tell someone, kasi most of the cases, 80% at least, they won't tell anyone until they're adults or even until the day they die, they will not tell anyone. But if they tell somebody, malamang kung alam ng tao na yan. That's the other thing that we do to educate in the community. Paano someone tells you, ano bang gagawin mo? No? Saan ka pupunta para matulungan yung bata? And we just say, come to the Women and Children Protection Unit sa ospital nyo. Sila na bahala sa lahat. No? Yun lang ang kailangan. Dalhin lang yung bata doon. But it does not serve as any purpose for the doctor herself to go to the community and look for cases. Hindi mo yan mahanap. No? Yeah.
Okay, so they actually come when they know someone cares, someone is willing to help them.
Yes.
It's not going to cost them, etc.
Yeah, and that they're not going to be traumatized again by the whole process. Kasi yung iba, kung hindi alam pa, that's why kailangan trained yung personnel. Kasi kung hindi yan sila trained, baka mas lalo nila matraumatize yung bata with the way that they treat them or the way that they speak about the topic, the way they question the child can be traumatic. That's why when we say these WCPUs na ito, mayroon talaga special training yan. We call them Women and Children Protection Specialists pag natapos nila yung training.
Well, it's nice that there is Women and Children Protection Units, but I think you would agree that it would be much better if we had Women and Children Prevention from protection.
Yes.
Prevention before protection. Now, I was just thinking...
Protection can include prevention.
Exactly.
They have many names.
Now, here's my question. Can this be part of the marriage seminar? seminars sa bago manganak, yung mga, di ba
Oh,
meron yun sa
definitely,
mga
we
barangay?
would like that. We would like that kung if it's part of it na yung marriage, 'di ba kailangan may certificate ka na may marriage seminar ka bago ka pwedeng ikasal?
Yeah.
Dapat may kasali niyang parenting program that they have to undergo. If we could do that, that will be very, very helpful in terms of prevention. Isang example lang. Isang prevention program na ginawa sa Amerika that reduced abuse of babies. We're talking about babies. Is teaching parents how to handle babies who cry and cry. You know, yung sabi, hangin lang yan, colic lang yan. May hangin sa tiyan, but the baby can cry for 4 hours straight, 6 hours straight. And if you have a parent who is highly stressed, may maraming problema, hindi makakontrol ng anger, they can harm the baby by shaking the baby violently to stop the crying. And that could lead to bleeding in the baby's brain. No, so just teaching parents how to handle crying of baby is already one preventive act that can save a lot of babies.
Okay, now we were talking about setting up the units. How open are local government units, government agencies? Kasi you've been around 25 years.
Yeah.
In 25 years, one would think that this is already gospel for everyone, especially with the realization that child abuse is prevalent in the Philippines.
Oh, we've been around the country. Itong 123 na, hindi 115. Yung 123 units na ito, majority of that is with local government units. No, we sign a memorandum of agreement with the governor if it's a provincial hospital. And the Legislative Assembly of the province has to approve that. And kasama dyan sa agreement na they will, may sweldo yung nurse at saka social worker at may some budget man lang to operate yung unit na yan. Siguro mga 1 or 2 lang yung sa lahat na MOA na sign namin o napuntahan. Maybe at the most, less than 5 yung hindi natuloy. And bakit hindi natuloy? No? And when we look at it, it's because pala yung hospital nila kulang yung doktor. Wala, you have provincial hospitals where halos wala silang doktor. In fact, yung mga doktor nila job order. So this is a health problem, not only in about giving women and children protection units, but ang ating mismo health system, marami ding problema. And one of that is the lack of healthcare workers. And second, kung may doktor man, wala silang social worker. No, ni isang social worker wala. So siguro meron namang social worker doon sa kanilang office ng Department of Social Welfare ng probinsya, pero they could not spare kahit isang social worker na magtrabaho sa ospital for this. So that's the other problem. So yun, it's not so much na ayaw-ayaw, na complete talaga against the idea. Of course, they will say, yes, we want. Wala naman nagsabing hindi. Pero they will give you all their problems kung bakit hindi mabuo yung minimum team na yan na doctor and social worker. Kahit part-time. We say kahit part-time just to start, no? Para meron. Now, they could also say na i-train nyo na lang. I-train nyo na lang sila pero hindi sila dedicated sa unit na yan. Meron kaming general training. No, na hindi naman siya specialized.
Okay, let's
pero
talk
may
about
problems yan ha. May problems yan.
Let's talk about the general training, but first let's go for a 1-minute break. When we come back, what modules training do you give and why is it a problem? We'll be right back here on Agenda. Welcome back to the program agenda, and this is our last segment. And for those of you who want to know more about Dr. Madrid, she has published several papers on child abuse and neglect, which have led to changes in policy and practice in the Philippines. She has been a consultant and trainer for different international agencies such as UNICEF, World Health Organization, UNESCO, and UNFPA. She has engineered changes in medical, legal, and social welfare paradigm on women and child protection in the Philippines. During the COVID-19 pandemic, Dr. Madrid and her team in the PGH Child Protection Unit launched the Tele-CPUs in the barangay, a new system to ensure that child protection services are continued despite the restriction of the pandemic. Talagang all-out total talaga ang commitment mo, Dr. Bernadette. Grabe ka. Anyway, speaking of training, you before we went to the break, you said that you offer trainings for LGUs that can't really assign dedicated personnel, but you said there are problems involved. Could you elaborate on that?
Yung training namin because of COVID, online na siya ngayon, no? So, and it's free. So, for example, for everyone, if they go to our website, childprotectionnetwork.org, and they go to training, we have a 4 hours training, 4 hours, because recognition, recording, reporting, and referral of child abuse cases. That's for everyone, no? And you can register anytime. You can pause and do it at your own pace. But of course, you should have internet access. Yun ang kailangan mo. Ngayon, it helps, no? It helps, of course, it helps in the recognition. At kung talagang natuto sila sa training na yan, at least they know the basics. Pero ang kailangan, dapat ready yung services, no? Kung people start reporting, no? They should expect na ano ba yung mangyayari sa report na yan. And but that's why we want this team talaga na with a physical presence, with an office, is because para mahanap mo sila. Saan ba sila? Saan ba ko pupunta? At ano yung ma-expect ko na serbisyo? And we find na kung magre-report at walang response, hindi na magre-report uli yan. You know, sabihin wala naman yan, o ganun. So that's why, yes, this increases awareness and everything, no? Pero as I said, kailangan pa rin may mapupuntahan sila. Sabihin mo, di pumunta sila sa barangay. Pero yung barangay, stopgap lang yan. Hindi naman yan sila magtitreat ng injuries o magbibigay ng therapy. They have to bring that also to a place that will give talaga the services as I have described. And ayaw mo na ipapasa-pasa, yan ang pinakaayaw ng mga pasyente. Na for this condition, dito ka pupunta. For this condition, pupunta ka sa ganung opisina. For this, kailangan mo ng ganitong tulong, doon na naman sa isang opisina, kung saan yon. They get lost. No? Wala na. And this is and dysfunctional ang mga pamilya nito. They're not going to pursige looking for services for themselves. Hindi mangyayari yun. So that's why while we have training and it's free, you know, and accessible, but of course internet-based for everyone, in the end, kailangan mo pa rin na may sasalo ng lahat yan. And this is the Women and Children Protection Unit.
What about the private sector? Have you gained support from the private sector? Because I mean, while you've been speaking to us this morning, I already thought of a senator who I will pester to help you. I already thought of an association in the medical field who could greatly help you. But what about, private sector in general?
Yeah, the Child Protection Network Foundation is supported by the private sector.
May we know who are your
yung board members?
Supporters?
Oo. Yung aming board, the chair is David Bradley, Americano, no? And that's a whole story by itself, how David Bradley came to love the Philippines. He's the chair emeritus of the Atlantic, no? And yung president, I see Irene Martel Francisco.
Okay, Miss Irene, yeah.
Yeah. And then we have Lizzie Razon. We have Rena Echanova Angeles. We have Mons Romulo.
Wow.
Alice,
these are well-known public figures.
Yeah, Alice Eduardo. Mia Borromeo. June C. Johnny Velasquez. So
hindi ka nagkukulang in terms of powerful figure in your board, but how about on the floor in terms of funding, in terms of logistics, or corporately speaking, corporations?
Corporations ang talagang tumutulong sa amin ay ICTSI. ICTSI Foundation. No, and then we have international, of course, UNICEF, UN Population Fund, Kindernat Hilfi, Consuelo Foundation, just to name a few. And then, of course, we have some embassies also who have helped us through the years. So, because sa pag-set up nito, of course, we need to train, and then we need to set them up na they have the basic equipment na meron sila para na alam ng tumatanggap na provincial hospital na yung burden sa pag-set up ay hindi lamang sa kanila. What we are asking from them is that they will provide the staff. No? Yun ang kanilang So the private sector is involved. And ang kailangan lang is that sana, and this is what we have asked the Department of Health and the local government unit. Ang kailangan talaga is that we have the staff. One doctor, one social worker, may plantilla siya, may sweldo siya. Because in the end, sino bang magde-deliver ng programa niyan? Tao. I mean, capital investment will not do anything. No? Yes, it's needed. Pero in the end, the one who will deliver the services is this doctor and this social worker. And they need to be there with an organic plantilla.
Okay.
Hindi yung wala. Kuminsan meron, kuminsan wala. And it cannot be volunteer. Ay, naku. Wala kang maasahan sa volunteer. Oo.
Yeah, not that they're bad people, but it's not consistent.
Yes.
It's not thorough. And syempre, pag inatake na sila or there is a threat of violence against them, nako, I don't want to waste my life on this.
At saka you don't know when they'll be there.
Okay.
And
anyway,
it's long-term. Long-term.
Yeah. Anyway, Dr. Bernadette, as usual, I've run out of time because of interesting topics and accomplished guests like yourself. Congratulations. We really appreciate this country, owes you a debt of gratitude for dedicating much of your life and your work to its children. And we pray that the good Lord will bless the work of your hands, grant you his favor, and just give you an army of supporters. Thank you very much for joining us, and congratulations on being a Ramon Magsaysay Awardee of 2023, Doctora.
Thank you so much, Cito, and for giving me this opportunity to really go into the details of what we do and to give us this time. Bihira yan.
Okay. Thank you very much. That's Dr. Bernadette Madrid, and she is the Ramon Magsaysay Awardee for 2023, also Executive Director of Child Protection Network Foundation Incorporated. Now let's go to our blessing, the blessing for this week, and it is from the book of Deuteronomy, chapter 34, verse 9. And Joshua, the son of Nun, was full of the spirit of wisdom, for Moses had laid his hands on him. This laying of hands, our dear viewers and friends, is about blessing. blessing others. And may you be a blessing to others as our guest has been. And may God bless all of you. Please stay dry. Take care over the long weekend. God bless all of you. I'm Cito Beltran. Thank you for joining us on Agenda. Keep it here on One News.